So if you're having knee pain and a surgeon's told you that you need a meniscectomy, a surgery to go in and remove out part of your meniscus, there's two things that you should know. One is that they did this very profound study where they took people that the MRI showed a meniscus tear and they separated them into two groups. One group, they actually did the surgery, they went in and took out the meniscus. And the other group, they just mimicked the surgery. They didn't do the surgery, they just did a placebo surgery. And what they found is the outcome of that study was that both groups, the outcome was the same. And the second thing to know is that when you get a meniscectomy, there's research that shows it can speed up the osteoarthritis progression, meaning it can lead people to needing a knee replacement sooner. Anytime you go into a joint and do surgery, it's going to disrupt that joint. And the meniscus is kind of a little bit like a shock absorber. And so if you take out part of the meniscus, essentially you're taking out some of that natural shock absorption, and that can lead to that progression. So some people do need a meniscus surgery, if their knee is absolutely lock in, or if it's a acute injury where they fall and they twist their knee and it's this huge tear. But if you're just having this kind of chronic knee pain, there's a lot of other strategies to try first. You can go on this YouTube's page channel, and I have a whole playlist of lower extremity exercises you could try. You want to make sure your foot is in good shape, that it's loose and it can move. You want to make sure your hamstrings and your quads are strong, that your hip is able to stabilize the femur from the top down, and that you don't have any core weakness that might leak down. Those are kind of the basic things to start with. And then there's always dry needling and manual therapy and things like that, which can be helpful. So the point of this video is don't rush into that surgery. Take the risk into consideration and try to make a informed decision.